Hello and welcome to Healthy Living. I'm your host, Dr. Donald Pelto. Today we're going to be talking about a relatively new topic called regenerative medicine. I have the privilege of having two guests with me, Dr. Neil Feldman and Dr. Benjamin Saviette. They're both board-certified podiatrists, and they're going to join us for this conversation today. We're going to discuss some of the newest types of treatments to help athletes recover quicker from injuries and many times avoid long surgical recoveries. So first we're going to look at what is regenerative medicine. To start, I want to define regenerative medicine, but I would ask either of the doctors to contribute as well. Regenerative medicine is a game-changing area of medicine that can help heal damaged tissue and organs for people that thought their conditions were beyond repair. One aspect of this regenerative medicine involves boosting the body's natural ability to heal itself. For example, if you get a cut on your finger, it will usually heal in a few days. However, other tissue, for example, on the bottom of your foot, if you're a diabetic, can be slow healing. Using a specially engineered covering on the wound can boost your body's natural healing process for this wound. Here's a picture of this type of a graft that is used on a foot wound. Another type of regenerative medicine involves replacing damaged tissue or organs from living or deceased donors, such as a heart or a liver transplant. If these heart or liver cells could come from the patient's own tissue, that would help solve the problem of tissue shortages for organ transplants and also the problem we currently have of organ rejection. But today specifically, we're going to talk in our conversation about the regenerative process inside of tissues. This involves delivering stimulated specific types of cells or cell products to go to diseased tissues where they will restore the tissue function. Remember, the goal of this area of medicine is to stimulate the body's own repair mechanism to heal something that previously couldn't be repaired. We are going to focus on three modalities within regenerative medicine. The first is going to be platelet-rich plasma, the next is shockwave therapy, and then finally we're going to talk about amniotic membrane therapy. First, I'm going to ask Dr. Feldman to talk a little bit about platelet-rich plasma therapy. So if you could first just start out explaining to me, what is platelet-rich plasma therapy?
All right, thanks, Don. Thank you for inviting me to the show. Platelet-rich plasma is also called PRP, and it's taken from your own body. We would draw blood from your arm, most likely your arm, and there's a centrifuge that we have in the office, and it'll get spun down. Plasma is your blood taken out of your body and spun so the red blood cells are separated out. The red blood cells are heavier, so they end up at the bottom of the test tube. And there's a yellow liquid. It's the blood components without the red blood cells that has, it's called plasma. And inside of that is a larger concentration of platelets. We take that and then we'll inject it into the diseased tissue, and the tissue being tendon, fascia, ligaments, or joints, or even bone for that matter.
And so with this platelet-rich plasma that you get, does everyone, if you take it from me and from Dr. Saviette and from yourself, are we all going to get the same amount and same quality of platelets?
No, it's going to depend on your body. Our platelet production is different for all of us at different ages, different cycles. It's based on a lot of different factors, how healthy you are, for instance. Some people have low platelets. Some people have excellent platelets. We don't typically get blood tests on people to determine their platelet count, but that's an area that could be explored. We're going to talk about it later, but that's what's so exciting to me about the amniotic membrane therapy, because it bypasses your own
using your own blood.
Using your own blood, and it saves the blood draw as well.
So once you have a patient and you take out the blood, you spin it down, you get this magic gold. Where would you want to inject it? Why this type of treatment and not a different type of a treatment, maybe like cortisone or something else like that?
Yeah, and in today's day and age, people are very leery about chemicals being put into them or anything that's going to be damaging or toxic to the body. Cortisone is wonderful. It's an anti-inflammatory, so it stops the inflammatory process. It can help reduce localized inflammation, and it can help with symptoms, there's no doubt about it. The problem is it also delays natural healing. It actually interferes with the body's natural healing response. Platelets are what promote the body's healing response. We want platelets to be called into the area because we want platelets to bring their growth factors, their special healing properties. They release their own stem cells. And stem cells are cells within your body that can become other types of tissues. They're called multipotent stem cells, so they can become bone, tendon, fascia, ligaments, joints, nerves. They can't become organs, not in today's day and age, not yet. Hopefully never, but or hopefully someday with the organs. But
So you take this special platelet-rich plasma, and then you inject it into, is it a tendon, is it a bone? What area of the body specifically do you use it for?
So if you have plantar fasciitis, it can be put right into the source of the plantar fasciitis. And nowadays it's really exciting. We have a diagnostic ultrasound at the office, so we can literally see the area of concern, whether it's plantar fascia, whether it's a tendon tear, whether it's Achilles tendon. We can literally see the structure, and we can see the disease part of the structure. We can see the needle going in to the structure. A little later we'll show you an Achilles tendon where there's actually amniotic tissue going in, but we can do the same thing with platelet-rich plasma, or PRP. So it's any of the tissues you need it to go into, we can put it into those tissues.
And is this something that's done in the operating room? Is it something that's done in your office? And what's the recovery like afterwards? Do you have to be out of work?
Yeah, you can do it anywhere. We actually do it right in our office. We have the ultrasound machine in our office. MRIs are typically the gold standard diagnostic study where you can see tissue disease. You can see tears in tendon, you can see splits, you can see inflammation, you can see cracks in bone. But the diagnostic ultrasound gives you real-time imaging capabilities, and we have it in our office, so you can do it right in the office. It's a blood draw. The spin on the centrifuge is about 5 minutes. So the blood draw, it's me drawing the blood. So if you're an easy stick, it's pretty quick. Sometimes it takes a little longer if you have a difficult vein. The spin itself is about 5 minutes. Sometimes we'll use a local anesthetic to the area to limit any discomfort that might occur from injecting it. If it's a larger area, if there's multiple areas within the plantar fascia or the Achilles, then PRP is a really nice choice because you usually we draw 15 cc's of blood. So that's about 3 teaspoons of blood, and that gets spun down. Typically we get anywhere from 3 to 5 cc's of plasma of the PRP, which, as you mentioned, we call it liquid gold because it's a golden color, and that gets injected into the area. So if there's larger defects, that's a really nice option to have. The procedure itself takes, if we're doing it under ultrasound, it might take a little longer, but from 30 seconds to 3 minutes. Afterwards, you get a Band-Aid or a soft wrap. Depending on the structure involved, you might go into a soft cast and a walking boot for up to 2 weeks, and as you're walking out,
that's what it is.
You might need a ride if it's your right foot, because you might need to be in a walking boot on your right foot.
And is there anything you can't do after? Can you take Motrin, ibuprofen, things like that?
You shouldn't, because again, those are anti-inflammatories. You could take Tylenol. You could use ice or heat, but we generally don't like the use of the anti-inflammatories because it will interfere with the function of the platelets. And the other thing I might add is the disease structures, the tissue tears, fasciosis, fasciitis, Achilles tendonitis, tendinosis. They're just conditions of pathology within these structures. The reason they become problematic in the first place is they don't have a great blood supply. And platelets get called into action to heal, but they need to come through the bloodstream. They need to come through capillaries. And if these structures don't have a really powerful or strong blood flow to them, you're not going to get nearly the quantity of platelets there that are needed for healing. Platelets release fibrin, and they also release factors that help with new blood vessel formation. So they actually promote blood vessel formation from within these tissues to increase your body's own ability to heal itself, and that's one of the real exciting features, and that's something that the Shockwave therapy also does, which we'll talk about.
I think it's a good segue. Dr. Saviat, do you have anything else to say about platelet-rich plasma?
Well, first, Dr. Pelto, thanks for having me on the show.
You're welcome.
Much appreciated. Big fan. Been posting a lot of the videos. About the platelet-rich plasma therapy, the people who, in the general population, who have probably heard of it the most are the people who are sitting at home on their couch on Sunday watching football. And you hear about, Martellus Bennett's out getting platelet-rich plasma therapy into his shoulder, or Vince Wilfork had it into his Achilles tendon after it was ruptured. These elite, high-level athletes. These guys, obviously, sometimes they have an infinite amount of resources to do anything to heal themselves, but some of these things, they make sense to the guys that want to get back out and participate a little faster. So.
And also maybe avoiding surgery. In the past, if you have one of these tendon injuries, a surgical option is what you were doing in the past, sooner.
Yeah. These athletes, too, were flying to Germany because the initial work was done over in Europe, Italy, Germany, and they were Tiger, Lance Armstrong, in addition to other things probably. Yeah. But these procedures.
Now you can have it in Worcester, Massachusetts.
Not the stuff Lance was on.
Yeah,
not that.
We don't do that.
Well, good. I think it's a good segue now to talk about our next topic is something called shockwave therapy. And Dr. Saviat, he's kind of researched just a little bit, and he's kind of at the forefront of shockwave therapy. So I'd like you to start talking a little bit about shockwave therapy, Dr. Saviat.
Absolutely. So I've been a big fan of shockwave therapy for several years. I've done multiple presentations and research projects on it myself, and been pretty much up to my eyeballs in it for a few years now. So was excited to join a practice where shockwave was a component of the practice. So what shockwave therapy is, it's not somebody just in there whacking away on you with a mallet or anything like that. It's a way to manipulate some of your soft tissues, be it a tendon or wound or a bone or a ligament injury, to try to stimulate a physiologic response that's innate and kind of already within your body, to get it to respond to an injury that might be there.
So let's, we're going to show a picture right now of an actual shockwave machine that we use. And could you explain a little bit how it works? What are the mechanics of it?
Yeah, so there are several different types of machines, but the machine we use in our office, it has a handheld device, essentially, that's connected to a machine. And then the machine provides a pneumatic flow of high pressure and low pressure. And what that does is it moves a projectile within the handpiece.
It's a little piece of metal.
It's a little, basically a little BB that oscillates back and forth within the handpiece, and you keep that handpiece in contact with the skin, and the projectile will hit the tip of the device, and then that creates basically a concussive wave that goes through your tissues. And that's the very easy explanation of it.
Yeah, and so those waves, you put a gel, ultrasound gel on there to conduct it?
There's a little conductance gel which just helps that energy really effectively get in there. You lose a lot less of the energy when you use a conductance gel. If you don't use a conductance gel, then you lose some of that energy to sound waves and the like.
Mm-hmm. And how was this first used, this technology? We're using it on the foot and ankle and tendons and things, but where was it first used?
So it really developed in the early 60s, I believe. They were using what are called focused shockwave machines, and what they would do is they would submerge a person into a tub of water, and that was their conductance gel, essentially. And they used an ultrasound, or rather a fluoroscopic X-ray device to target kidney stones, and then they would shoot a high level of energy at a focused distance, and it would come together and hit this kidney stone, causing it to oscillate and fragment. So rather than passing a lima bean-sized kidney stone, which I imagine is probably pretty painful.
It's really painful.
You end up passing sand. So it fragments that calcium-based kidney stone and causes it to break apart, and then you can pass it without much pain. So that's where it developed.
Yeah.
But what they were starting to see is some of these people who were in these tanks were relating, oh, hey, my lower back pain is starting to go away. And then some other folks got got kind of wise to that and started using it for different things. The earliest research after that was in calcific shoulders. There's been some stuff on lateral epicondylitis, so tennis elbow. And then from there, some different entrepreneurial doctors started using it for different things. They said, hey, I'm reading about this. Let me try it for plantar fasciitis. Let me try it for Achilles tendonitis.
And that's how you primarily use it?
Yeah, so initially I kind of got wise to it for plantar fasciitis. Plantar fasciitis is one of those things, 90% of people get better with the standard of care treatment, whether it's physical therapy, steroid injections, night splints, some home stretching, foam rolling. 90% of people get better with that. There's the 10% then that end up in this chronic phase where it's not improving after about 6 months. And then you tend to see research on that 10% of people who don't get better with things.
Okay.
And it's been utilized a lot in that population. So people who were not improving and then they got shockwave therapy and they start to improve.
And so what do those, if we're talking about the kidney stones that get targeted and they get broken up, what are you doing with the fascia? Is it breaking it up? Is it causing an acute injury?
So it's not so much causing an acute injury. I have heard that before. It's kind of an easy way for a doctor to explain what's about to happen physiologically to you. And I've been guilty of it myself at times to say, hey, here's the long and the short of it. I give the Cliff Notes version. But in reality, what this is it's not so much causing an acute injury as causing your tissues to respond as if there is an acute injury. So when those physical energy waves from the impact of the projectile get to your tissues, your cells respond to it. Our cells are always responding to the environment that we live in. So if you start to run a lot, over time your bones become more dense to accommodate that level of forces that are going through your body. So this is very similar, except it's a high level of energy focused into certain tissues. So that mechanical energy then gets translated into chemical signals that our body responds to and causes a healing response in a lot of different tissues.
So let's try to simplify this down. So you hit a piece of tissue, whether it be an Achilles tendon or a plantar fascia, you hit it really hard. For how many times do you hit it? Is it usually 20 minutes, 5 minutes?
Depends on how many areas we're treating. The standard for most injuries is around 2,000 shocks. And we do it at a frequency of around 10 hertz, so you can pretty much hammer through that in about 5 to 10 minutes if you're working hard.
So you do that, and then there's a response from your body. What happens? What does your body do after
So
that?
the whole cascade is very elaborate. Oh, yeah,
we're going to put a picture. Let's put a picture
up
of the cascade, so you can explain that another day. You can email him if you want to learn it.
It's mind-numbing. It's kind of the thing. Who needs Ambien when you have chemical cascades,
yes.
right? What it does, the main thing that it does is it creates a vascular ingrowth process through this chemical signal called VEGF. I don't want to bore you with what it stands for, but it creates this cascade of events. So what Dr. Feldman was mentioning before about creating where there's an area that there's dysvascularity, not good blood flow, we're trying to institute some better blood flow. So really you're getting little arterioles and capillaries that grow in and begin to heal that tissue with better blood flow to that area.
So kind of comparing the two with PRP and then with Shockwave, is it one treatment for both of these, or is it multiple? And how long do you have to wait to see the results for either of these?
So PRP is usually a single dose treatment or several months apart with doses, if I'm not mistaken.
Yeah, it depends on the tissue, it depends on the extent. I might do 2 injections over the course of 3 to 4 weeks separation, or 6 weeks. I might just do the one as well.
And for shockwave therapy, it really is dependent on what the particular injury is. So if you have an Achilles tendonitis, usually the standard for that is once a week for 3 weeks. There's different literature that says once a week or once every 2 weeks for 6 weeks. But what the literature is pretty clear on is that it can take 6 to 12 weeks for you to really see a result with
So you have to be patient.
With shockwave therapy. So you need to be a little bit patient with it, but the results really are there for injuries that are both chronic and acute. You get a lot of high-level athletes that have an injury that's not responding, and they want something done to just get the stupid thing to heal so they can get back to what they want to do. So there's a lot of that.
Yeah, this typically isn't a quick fix. This is regenerative medicine. Your body has to heal itself. This isn't a movie that shows healing in a lab, and it takes time for your body to heal itself. So
and it's probably going to be for those patients then are going to want to avoid surgery. So this is kind of like the last step before surgery for a lot of these.
It can be. That being said, if you're a high-level athlete or you're a semi-professional, or you would go nuts if you couldn't run every day like some of us, you kind of need your medicine out in the woods to go for a run. So some of those people, it's worthwhile to, if it starts to hurt, come in and get it treated early. It's kind of the penny of prevention.
In this one, there's no drawing of blood. There's nothing. It's a machine. Takes 2 or 3 minutes.
It's relatively low level of pain. So we start at a low level of energy to try to introduce you to the handpiece.
Kind of like when you're tapping it to go numb, and then you can increase it.
Our body's desensitized, just like my butt doesn't feel sitting in this chair anymore because I've been sitting in it for a while. Your body kind of responds and doesn't feel so much pain in that situation anymore. So the important thing is we have to get you to a certain energy level with the handpiece, or else it's not getting enough of a chemical response from your cells.
Okay.
That being said, we were talking about how it's not an acute thing. There is a level of pain relief that comes with shockwave therapy. Cellularly, you release a substance called substance P, and that dampens pain responses. And I know everyone's like, oh, must be the placebo effect of somebody hitting you with this little projectile, but it's actually been seen in veterinary studies as well on horses. A horse can't tell you that they feel better. All they can do is chomp on carrots. So they don't walk away lame afterwards. They're walking more normal after shockwave therapy. Yeah.
And similar to this other treatment we were talking about, or comparing it, is it only used on the plantar fascia and Achilles tendon, or can it be used on other areas? I think we've talked before about bones and wounds.
You and I have talked about this, but there's really good literature on several things. Plantar fasciitis is a good one and has been studied very hard. Achilles tendonitis, both right where the Achilles attaches to the bone, and above that where it's particularly not well vascularized.
So we'll show these pictures here so they can see these
those
two
areas. Also, it's been used for non-healing wounds or surgery sites. So that's skin wounds and diabetic ulcers. Sometimes those things need a little jump start with some increased blood flow. And I've done that several times in the office already. And then there's the non-healing fractures that sometimes need.
That's kind of a unique use for it.
It is a very unique use, and I've seen it used for acute fractures and kind of the garbage term of shin splints. I've seen it used for that as well.
Well, interesting. Sounds like
foot pain too.
Yeah,
works very well on the ball of the foot.
On the ball of the foot. And so the big question that a lot of people that are probably watching this are thinking, well, if all the athletes are doing these great ones, the PRP and the Shockwave, is it something that insurance covers at this point, or is it not covered? Who covers it?
So
that's where it comes down to for our patients.
It does. It's one of those things. Insurance companies are not in the business of getting you healthy as fast as possible. They're in the business of trying to keep you healthy. So it's unfortunately as well studied as Shockwave is. It's one of those things that most insurance companies will not cover in the United States.
But in Europe,
in Europe, it's well covered. So
you can go to Europe and do treatment.
If you want to fly to Europe and do a vacation and get your Achilles tendonitis treated, you could do that. I still think we're probably
less expensive.
Unless if you fly over, you're on their universal health care, I guess. So that being said, it's one of those things that if you've tried several other modalities and it hasn't gotten better, it's not toxic to tissue the way that steroid injections are. You can only do so many steroid injections into a plantar fascia before you're looking at a rupture just around the corner. So you don't have to stay out of activities if you have shockwave therapy, which I think is one of the strongest reasons to go for it. If we do a steroid injection into your plantar fascia, we're going to tell you not to run for at least a week. we're probably going to put you in a boot too. If you get shockwave therapy, have at it.
There's no downside. Anything you want to add to the shockwave therapy, Dr. Feldman?
It's great with the buildups people have during the latter. So the big training for marathons and triathlons, whether you're training for an Ironman or a half Ironman, or just those, you spend a year of your life dedicated to a single day event, and you're putting your body through a lot to get to the race day. So if your body's not responding very well and you start showing signs of injury and fatigue or failure of some of the tissues to kind of hold up to what you're asking it to do, this is where the regenerative medicine makes so much sense, because you're helping your body get through it. So Shockwave is done often in the buildup right before a marathon, maybe in the last 3 to 4 weeks, called the taper phase of that, or a triathlon, or to get somebody through the big build phase that is 2 months before the event.
And there's really no downside to it.
Really just the insurance not covering it, so the patient has to be willing to do it, and to also pay attention to all the little things that go with it. It's not like, have a shockwave treatment and you're healed.
And you're going to be healed.
Yeah, you still have to work hard at keeping your body as healthy as possible.
Yeah, it's very, very exciting.
Yeah. Shockwave's not a license to go nuts and keep hammering 100-mile weeks. It's kind of a warning sign, get you healed, maintain, and then usually you're back at it.
And get you through it.
And
And the whole goal of this would be to get you back quicker than you would normally get back to the activity.
Right.
You're at your same level. That's great. That's great. And this by no means is a comprehensive conversation about the topic, but it's guided to help us to treat the conditions that in the past we could only treat with surgery. And if you're wanting to learn more, you can go to the website, centralmasspodiatry.com, and you can learn more about these types of treatments. So I'd like to thank both Dr. Feldman and Dr. Saviette being my guests here on the show today.
thanks for having us, Don.
Thank you.
Thanks for having. Maybe we can do it again.